What will I learn by taking the myBRCA or myBRCAHirisk screening test? You will get one of three results from either the myBRCA or myBRCAHirisk tests: positive, negative, or inconclusive. A positive result means that we've detected a harmful or pathogenic variant that increases your cancer risk and possibly that of your family members. The cancers you are at risk for depends on the gene the variant was identified in. Although this is frightening information, there are measures you can take to detect cancer sooner or even possibly prevent it entirely. For example, women with a pathogenic variant in their BRCA1 or BRCA2 genes have an increased risk for breast and ovarian cancer and should consider earlier and more frequent screening and risk-reducing surgery. On the other hand, men and women with a pathogenic variant in the MLH1 gene, which causes a condition called Lynch syndrome, have an increased risk for colon and rectal cancer and should consider earlier and more frequent colonoscopies. A positive result does not guarantee that you will develop cancer. Other genetic and non-genetic factors such as your environment, behavior, and lifestyle also play a role in your cancer risk. It's important to share your test result with your relatives, and your providers can help you identify who else in your family may benefit from getting tested. Pathogenic variants in these cancer susceptibility genes are passed on in an autosomal dominant pattern. This means that there is a 50% chance that your parents, siblings, and children could have inherited the variant as well and be at an increased cancer risk. Some individuals may also learn from these tests that they are carriers for other genetic conditions. Please speak with your providers to learn more information about what these conditions are and your risk for them. A negative result means that we did not identify a pathogenic variant in the genes we screened. Interpreting a negative result can be tricky because you have to take into account your personal and family history. And a negative result doesn't mean that you have no risk for developing breast or ovarian cancer, since there are other genetic and non-genetic reasons why someone may develop these cancers. There is also a small chance that your genes contain a variant that can't be seen with today's technology, meaning that you may also have a gene that hasn't been discovered yet. An inconclusive result means that we found a variant in a gene, but the implications of that variant are unclear. This is called a variant of uncertain significance, or VUS. The scientific community either doesn't currently have enough information to draw conclusions about that variant, or there is conflicting information in the medical literature. In some cases, testing of family members may help contribute to our understanding of a VUS. Never base healthcare decisions on inconclusive gene test results. Your doctor or genetic counselor can review with you the existing cancer screening and risk-reducing guidelines. If none exist for the particular gene you were found to have a variant in, or if testing was negative or uninformative, they can help you determine what screening is appropriate for you based on your personal and family histories.